So, definition. Integument is something that courses or enclose the assessment of the integument help provide information about the nutritional and hydration status of the patient. So the purpose is to identify if there is abnormalities that the patient is experiencing. So the equipment are gloves, examinational gown, bath blanket, measuring tape, PPE as the indicated, adequate light sources. So the consideration before, during, and after the procedure is ask the client and approval, provide in privacy, performance, and hand washing, history of rashes, allergies, itching and bleeding, and bruising. So, the things to document after the procedure: document all the findings, any abnormal and abnormal finding, that signs and symptoms.
Fully exposed area to be examined, adequate exposed and necessary for the thorough examination. Test under strong direct light. This too weak indirect lighting can distort colors and mask and duties list. Note general color as well as the local variation. Inspect the uniformity of the skin color. This color should be consistent with the genetic background. Inspect, palpate, and describe skin lesion. Describe the skin lesion size, shape, color, distribution, configuration, and if there is any drainage, tenderness, or pain. This may be the indicative of traumatic or phontologic changes. Palpate skin temperature with the dorsal aspect of your hand. This to provide insight to circulatory status, infection, or trauma. Palpate skin texture, moisture, and hydration. This to provide information regarding metabolic activity and fever. Palpate skin turgor by gently pulling the skin and noting its return. This to provide data or fluid status, weight, or gain lost. Assess for the presence of edema by firmly pressing over bony and area for the tibia or ankle. This to provide information, fluid status, and inactive possible conductive heart failure, kidney failure, or local problem, especially if the indicator lateral. Note the location, color, temperature, shape, type of degree to which the skin remain inundated and tilted with a depressed by finger. Measuring circumference of the extremity with the millimeter tape by using full for future comparison. Inspect the nail plate shape, texture, nail bed color, the tissue surrounding the nails. This to provide information and perfusion and oxygenation status. This in the capillary field by pressing on the nail and releasing this to use to monitor the hydration and amount of the blood flow in the tissue. And then take note how many seconds did the color return to its usual color. This is the cyanotic and sluggish color return to the suggest cardiovascular or respiratory disaffection. Note the consistency and smoothness and thickness and adherence to the nail bed. This to indicate the nutritional cardiovascular of the respiratory condition. And note the shape and contour. This is puggy nail base and indicative of the chronic cytonic condition such as the